Participants, once again, those who have joined, welcome you to this webinar on effective implementation of the Infant Milk Substitutes, Feeding Bottles and Infant Foods Regulation of Production, Supply and Distribution Act. And welcome Dr. Gayatri from UNICEF, Dr. Achita Gupta from WHO, and Zarrin, who is going to coordinate this work and will be the first to introduce this webinar and introduce the speakers of this webinar. So go ahead, Zarrin, over to you.
Thank you so much, sir. Good afternoon, everyone. I'm Zarrin Ashraf, District Program Officer, BPNI, and we take immense pleasure to welcome you for attending this webinar on effective implementation of the IMS Act. In 1922, the Government of India recognized that baby food promotions is much more rampant than promotion of breastfeeding, and it leads to morbidity and deaths among young children. Therefore, the Government of India enacted the Infant Milk Substitute Feeding Bottle and Infant Foods Regulation of Production, Supply and Distribution Act 1992 and Amendment Act 2003. IMS Act in order to regulate marketing of baby food as follow up to International Code of Marketing of Breast Milk Substitute. We are here to discuss about different provisions of the Act, examples of the recent violation by the baby food companies and feeding bottle companies, and we'll talk about recommendations for effective enforcement of IMS Act. Let me introduce you all to the host of this webinar, Breastfeeding Promotion Network of India. BPNI was founded on 3rd December 1991 at Wardha, Maharashtra. It is a national network of organizations and individuals dedicated to promote mother and child health through protection, promotion, and support of breastfeeding. Among other works undertaken by BPNI, capacity building, advocacy, networking, World Breastfeeding Trend Initiatives, and WBCI are some of its international and national work. All of our viewers can visit our website at www.bpni.org to know more about us and our work. Now, I would like to welcome our esteemed panelist, Dr. Achita Gupta. She is a public health nutritionist with over a decade of experience. Dr. Achita Gupta is the National Professional Officer Nutrition at the World Health Organization's Country Office for India, that is WHO India. At WHO, her portfolio includes advocating on nutrition and health issues and providing technical support to Ministry of Health and Family Welfare, Ministry of Women and Child Development, Niti Aayog, Food Safety and Standard Authority of India. Welcome, ma'am. Welcome, ma'am. We are very happy to have you here. I also take immense pleasure to welcome Dr. Gayatri Singh. She is the Child Development Specialist, UNICEF India. She is a professional in the field of public health nutrition and holds a PhD degree in nutrition. She is currently working as Child Development Specialist in UNICEF, New Delhi. In UNICEF, she leads the work on infant and young child feeding. She has worked extensively with the national and state governments, academic institutions, and with NGO partners in designing, implementing, and managing large-scale programs for early childhood development and nutrition. It is a pleasure to have you here, Gayatri ma'am. Thank you so much. I would also like to welcome Dr. J.P. Dhadij, who is the National Coordinator and Technical Director of BPNI. He is a pediatrician based in Delhi. He has been restored with the Fellowship of National Neonatology Forum of India. He has been an integral part of BPNI since more than 1.5 decades. He is the co-chair of the Global Council of International Baby Food Action Network. A very warm welcome to you, sir. I also take immense pleasure to welcome our chairperson, Dr. Arun Gupta, sir. He is the Central Coordinator BPNI and a pediatrician in public service and founder of Breastfeeding Promotion Network of India. Welcome to you, sir. Now I would request Dr. Arun Gupta to take over.
Yeah. Thank you very much, Zarrin. And as I I'm playing the role of a chairperson, so I'll invite all the panelists one by one to take on the topics to talk about it. And to the participants, I will advise you to, if you have a question, please type in the Q&A, not in the chat. Please, we will not be able to take on live questions or answers in this webinar. So, but we will try and answer every question which is asked at the end of the we have 5 presentations, and we are waiting for the Joint Secretary of Ministry of Women and Child. She will join us later.
I just talked to her, Dr. Arun, and
Yes.
she's informed that she will join at around 12 o'clock.
All right.
Yeah.
So that's fine. That in any case, her presentation is in the end, so we can manage that.
Yeah.
So the program of today is that first Dr. Dadich will speak on the history and provisions. Then Dr. Rachita will speak on IMS Act alignment with the International Code of Marketing of Breast Milk Substitutes and relevant World Health Assembly resolutions. Then Dr. Gayatri, she will speak on India's perspectives for UNICEF India's perspectives for implementation of the IMS Act, focusing on how do we get into the states. And then we will have the Ministry of Women and Child Development. Ms. Asta Saxena is the Joint Secretary. She will be talking on the how department is implementing the IMS Act. So this is the, and after this, we will have half an hour of question and answers. So whatever the questions arise, right along with the presentation, please write them. We can try answering them during the discussions, and then we can, remaining questions can be answered. Whatever is still left out and the time is over, we will try to reach you through the emails after the session is over in coming few days. So that's how this session will proceed. So I'll now invite Dr. Dadich. You have 15 minutes for your presentation on the history and provisions of the IMS Act.
Good morning to all the fellow panelists and participants. Friends, in my presentation today, I will provide some information about the history of breastfeeding protection globally, why the IMS Act was enacted in our country, and finally about few important provisions of the Act. First, I come to the history. It began with the World Health Assembly, WHA, adopting the International Code of Marketing of Breast Milk Substitutes. In short, we call it the Code, in 1981. The aim was to control the inappropriate marketing of infant formula and related products, which was contributing to the decline in breastfeeding rates and increased child morbidity and mortality around the world. The code provides a set of recommendations to regulate the marketing of breast milk substitutes, feeding bottles, and teats. The code aims to ensure that breast milk substitutes are available when needed but not promoted. The code has been strengthened in subsequent WHO resolutions. These resolutions were adopted to address evolving and ever more pervasive marketing practices which undermine breastfeeding and optimal infant and young child feeding, as well as to reflect new global health recommendations since the adoption of the code. While the code was being passed in the WHA, India's Prime Minister at that time, Mrs. Indira Gandhi, made a strong supportive statement for its adoption. Recognizing this as a major public health issue, the Government of India in 1992 enacted the Infant Milk Substitutes, Feeding Bottles, and Infant Foods Regulation of Production, Supply and Distribution Act 1992. In short, we call it the IMS Act. This came into force on 1st August 1993. But baby food manufacturers continued to adopt new strategies to defeat this law, and Government of India then moved an amendment to the Act in 2003. The intent of the IMS Act can be sensed in the statement of object and reasoning. While the bill was being introduced in the parliament, and this emphasis in the statement was added by me, by the then Human Resource Development Minister in 1992. This slide shows a part of it which says, and I quote, promotion of infant milk substitutes and related products like feeding bottles and teats do constitute a health hazard. Promotion of infant milk substitute and related products has been more pervasive and extensive than the dissemination of information concerning the advantages of mother's milk and breastfeeding, and contributes to decline in breastfeeding, unquote. Of object and reasoning of the IMS Act also recognized that inappropriate feeding practices lead to infant malnutrition, morbidity, and mortality in children. This has been proved correct by findings of a recent study. The study estimated that in India, health outcomes attributable to not breastfeeding include about 100,000 preventable child deaths, 34 million cases of diarrhea, 2.4 million cases of pneumonia, and more than 40,000 cases of obesity in children each year. And in mothers, more than 7,000 cases of breast cancer, more than 1,700 cases of ovarian cancer, and more than 87,000 cases of type 2 diabetes each year. Scenario in 1992 must have been worse than this. An effective national law can restrict the breast milk substitutes consumption. It is visible from this graph that IMS Act has played an important role in restricting sales of BMS in India, which is considered a very strong law. In comparison to China, which doesn't have a strong national law to regulate the marketing of BMS. The blue graph is China, and this yellow graph is, yellow shade is India. When compared with in China, 38% rise. In India, the increase in consumption of BMS is only 14% over a period of 6 years, from 2011 to 2016. With this background, let us now see some key provisions of the IMS Act. The IMS Act provides specific definitions for 10 different terms used in the law, such as the infant milk substitutes, infant foods, feeding bottles, and promotion, advertisement, etc. The definition of promotion is very comprehensive. It says promotion means to employ directly or indirectly any method of encouraging any person to purchase or use infant milk substitutes, feeding bottles, or infant foods. The law also defines the health worker and the healthcare system. I'm not going into details of these definitions for the want of time. There are 26 sections and 9 rules in the IMS Act. I will share some of the important sections with you. Section 3 of the Act prohibits all types of advertisements and promotion of infant milk substitutes, feeding bottles, or infant foods by any means. Section 4 prohibits giving incentives like free gifts, rebates, discounts, and tied sales of infant milk substitutes, infant foods, and feeding bottles. Section 5 restricts donation of products like infant milk substitutes or feeding bottles or infant foods, educational materials such as health cards, or equipment like a bookshelf to a hospital as shown in this slide. Section 6 prescribes guidelines for labeling with some mandatory information on labels of all the infant milk substitutes and infant foods, and certain prohibitions on the labels of these products. For example, the labels cannot have a picture of a baby, of mother, or graphics to increase sales. Section 7 mandates providing accurate information through educational materials to the mothers. Section 8 of the Act prohibits promotions and displays of posters, placards, etc. of products under purview of the IMS Act in hospitals, clinics, and chemist shops. This section also mandates that only a health worker can demonstrate feeding with infant milk substitute or infant foods to a mother of an infant or to any member of her family. Section 9 prohibits contributions and pecuniary benefits to healthcare workers and their associations. It prohibits funding of seminar, meeting, conferences, educational courses, contests, fellowships, research work, or providing sponsorship by a producer, supplier, or distributor of infant milk substitutes or feeding bottles or infant foods. It also prohibits providing any gifts to the healthcare workers by these manufacturers. Section 10 bans fixing the performance-based remuneration of any of the employees or give any commission to such employees by the person who produces, supplies, distributes, or sells infant milk substitutes or feeding bottles or infant foods. Section 21 and Rule 4.1 provides directions for authorizing personnel or organizations for monitoring violations of the IMS Act, which includes government officials and also voluntary organizations notified by the government of India. BPNI was authorized by Government of India to monitor the IMS Act through a gazette notification in July 1995, on 24 July 1995 to be precise. And recently, FSSAI has issued an advisory to all the central licensing authorities and designated officers and commissioners of food safety of all states and UTs regarding strict compliance with provisions of the IMS Act. According to the advisory, relevant sections of the FSSA and the IMS Act empowers the designated officers or the food safety officers to make a written complaint before the court to take cognizance of any offense punishable under the IMS Act. Section criminal procedures apply in the IMS Act, and according to the section 23 of the Act, an offense punishable under this Act is a cognizable offense and it is bailable. And section 12 mandates that provision of the Code of Criminal Procedure that of 1973, that is 2 of 1974, relating to searches and seizures apply to every search or seizure made under the IMS Act. So in the end, I would like to conclude with these key points. The IMS Act is a strong tool to protect breastfeeding from aggressive promotional activities of baby food and feeding bottle industry. So far, the Act has helped the country in restricting the sales of the baby foods. This is all I wanted to tell you about the IMS Act. I stop here. You may get more information about the IMS Act on BPNI's website at the URL given in the slide. Thanks for your kind attention. Thank you. Over to you, Dr. Arun.
Thanks a lot, Dr. Dadij, for your elaborate presentation in such a short time. In a couple of things which I have got some through questions, I'll probably postpone it to the end. So the question is about how to protect and whether the government can do anything or not. So we'll go to that. But for everyone to really take note of it, that India still has a lot to do in terms of like 27,000 tons of baby food, baby milks actually going into our babies at the time of first couple of years, 2 or 3 years, right? Yep. Is it 3 years, JP?
Sorry?
That the volume of consumption is 3 years, first 3 years?
Yes.
So 27,000 tons, and out of that 10,000 tons is being consumed during first 6 months of life,
Yes.
which means per capita consumption of the newborn babies would be around half a kg, every baby, if you go by an average. So the question to all of us is, do we want to reduce it further in terms of protecting our babies? Of course, we are doing better than China, no doubt, but can we do further reduction? How we can do it? So this is another question to the audience also. If you have any suggestions for that, to how to reduce the consumption of infant formula during first 6 months further, so please do write in the suggestions or question box, so that we can take on and build on an environment later. Thank you once again, Dr. Dadich, and I now invite Dr. Rachita Gupta from World Health Organization to talk on the alignment and also share her views on how do we go further on implementing the IMS Act in India, so that it can be, the implementation could be effectively enforced law to answer the question I asked just now. Thank you so much for coming, and over to you, Rachita. You have 15 minutes, please.
Thank you so much for the warm welcome, Dr. Arun. Good morning to all the participants and fellow panelists, Dr. Dadich, Dr. Gayatri, and Dr. Arun. Thank you to the organizers for inviting me to this important webinar today. Building upon Dr. Dadich's presentation, I will be talking about the International Code of Marketing of the Breast Milk Substitutes, which is commonly referred to as the Code, and the subsequent key World Health Assembly resolutions on breastfeeding and the alignment of the IMS Act with the Code. The code was adopted in the 34th session of the World Health Assembly in 1981 as a minimum requirement to protect and promote appropriate infant and young child feeding. It aims to not only regulate marketing of breast milk substitutes, feeding bottles and teats, but also ensure proper use of breast milk substitutes when necessary on the basis of adequate information and through appropriate marketing and distribution. It represents the collective will of governments to ensure protection and promotion of optimal feeding for infants and young children. The code is an important part of creating an overall environment that enables mothers to make the best possible choice based on impartial information and free of commercial influences, and to be fully supported in doing so, since inappropriate marketing of food products that compete with breastfeeding is an important factor that often negatively affects the choice of a mother to breastfeed her infant optimally. Given the special vulnerability of infants and the risk involved in inappropriate feeding practices, usual marketing practices are unsuitable for breast milk substitutes and hence need to be restricted. The code sets out detailed provisions with regards to information and education on infant feeding, promotion of breast milk substitutes and related products to not only general but also health workers and in healthcare settings. It also covers labeling and quality of breast milk substitutes and related products, and most importantly, the implementation and monitoring of the code. It's not only applicable to manufacturers, distributors, and retailers of any of the prohibited items, but also to healthcare workers, both professional and volunteers, healthcare facilities, both public and private, big hospitals, and small clinics. The code prohibits all forms of promotion, like I said, to both parents as well as healthcare providers. However, it permits use of formula with safe preparation for babies who actually need, sale of products with technical information, scientific and factual information for health professionals, as well as accurate information on safe formula preparation to be presented on the labels of the products. The code has not been updated, but followed by subsequent resolutions which have reiterated the importance of the code, clarified provisions, or added to it. The code and the subsequent relevant World Health Assembly resolutions must be considered together in the interpretation and translation into national measures. The resolution of the 39th World Health Assembly clarified that maternity wards should purchase breast milk substitutes through normal distribution channels and not receive free or subsidized supplies from company. The 49th World Health Assembly resolution urged countries to ensure that complementary foods are not marketed in ways that undermine exclusive and sustained breastfeeding. The 54th World Health Assembly resolution updated the recommendations on exclusive breastfeeding from 4 to 6 months to 6 months, while the 50th World Health Assembly resolution urged countries to ensure that nutrition and health claims are not permitted for breast milk substitutes. The 65th World Health Assembly endorsed the Comprehensive Implementation Plan for Maternal, Infant, and Young Child Nutrition for strengthening legislative, regulatory, and other effective measures to control the marketing of breast substitutes, whereas the 69th World Health Assembly urged countries, manufacturers, and distributors, healthcare professionals, and the media to implement the new guidance on ending inappropriate promotion of foods for infant and young children that contain a number of implications for the code. Some of the important implications that this new guidance brought were clarifications such as formula milk and growing up milk fall under the scope of the code and should not be promoted. It also recommended that messages on complementary food should always include a statement on the need for breastfeeding to continue through 2 years, and that complementary food should not be fed before 6 months. Also, it recommended that labels and designs on products other than breast milk substitutes need to be distinct from those used on breast milk to avoid cross promotion. Sorry, it's not that I've not skipped the slide. It's something not there on the slide. Sorry. Yes. So it also recognizes that any donations to the healthcare system, whether it's healthcare professionals or associations from companies selling foods for infants and young children, represent a conflict of interest and should not be allowed. It also recommended that sponsorship of meetings of health professionals and scientific meetings by companies selling foods for infants and young children should not be allowed. Some of the other relevant global initiatives which have been instrumental in promoting breastfeeding globally include the Baby Friendly Hospital Initiative, which was launched by WHO and UNICEF in 1991, followed by the Innocenti Declaration of 1990. It reflects global effort to implement practices that protect, promote, and support breastfeeding in facilities providing maternity and newborn services. It also serves as a significant tool for the application and monitoring of the code in maternity facilities worldwide. The guidance for BFHI was updated last in 2017 by WHO with the revised 10 steps for breastfeeding along with specific implementation guidance, FAQs, and training package, some of which were launched very recently during the World Breastfeeding Week celebrations this year. The Global Strategy for Infant and Young Child Feeding was launched in 2003 to revitalize efforts to protect, promote, and support appropriate infant and young child feeding. It builds upon the past initiatives, in particular the Innocenti Declaration and the Baby Friendly Hospital Initiative, and addresses the needs of all children, including those living in difficult circumstances, such as infants of mothers living with HIV, low birth weight, and infants in emergency situation. The Global Network for Monitoring and Support for Implementation of the Code, commonly referred as NetCode, was established in 2014 by WHO and UNICEF. It aims to assist countries and civil societies in strengthening capacity to monitor the code, and the relevant World Health Assembly resolutions passed subsequent to that, and ensure effective enforcement and monitoring of the national code legislation and regulations. Key non-governmental organizations such as IPFAN, Save the Children, academic centers, and selected countries have joined the network. An early initiative of the NetCode has been the development of a monitoring protocol to provide countries with practical tools and guidance for setting up effective monitoring systems to help eliminate inappropriate marketing of foods for infants and young children, as well as to regularly assess the level of adherence with the code and national measures. The Global Breastfeeding Collective is a partnership of prominent international agencies calling on donors, policymakers, philanthropists, and civil society organizations to increase investment in breastfeeding worldwide. It is born with a vision of a world where all mothers have financial, emotional, and technical and public support they need to ensure optimal breastfeeding, and advocates for smart investment in breastfeeding. It helps policymakers and NGOs in developing countries to implement solutions, galvanizes public support to get real results in increased rates of breastfeeding. The IMS Act, as we understood from the previous presentation, demonstrates the importance of comprehensiveness. I would now like to draw your attention to the alignment of the IMS Act with the Code to reflect upon this comprehensiveness. As per the recently released 2020 status report of national implementation of the International Code by WHO, India's IMS Act is substantially aligned with the code, scoring 78 out of a total 100 based on performance of several indicators aligned to critical aspects of the code, which I talked about a while ago. I will now discuss in greater detail as to what are the gaps that remain in this alignment, which we need to address to make the Act more robust and ensure full compliance. As far as the scope of the IMS Act is concerned, it scored 16 out of 20 with most breast milk substitutes and related products for children up to 2 years of age under its ambit. However, the Act may be expanded to cover milk for mothers and other designated products not suitable for infants, such as sweetened condensed milk, which may be used for surrogate marketing. The IMS Act contains several gaps in addressing the needs for appropriate information and education on infant feeding, which is why it scored only 4 out of 10 in this domain in terms of its alignment with the code. The Act needs to ensure that not only does it ensure availability of adequate information on proper use of formula and risks of its intrinsic contamination, it simultaneously prohibits informational educational materials from industry, use of pictures or text idealizing breast milk substitutes, apart from putting in place procedures which require breast milk manufacturers to seek necessary approvals for donation of company materials. The IMS Act comprehensively restricts all forms of promotion of breast milk substitutes to general public and mothers, and hence has scored 20 out of 20 on this aspect of the code. Similarly, the IMS Act also prohibits all forms of promotion and marketing at health facility level and is fully aligned to the code, thus achieving a full score of 10. A score of 13 out of 15 shows that the IMS Act is quite well aligned with the code in terms of restricting promotion of breast milk substitutes and related products to health workers and health systems, but few gaps still remain. It needs to define disclosure of unprohibited fellowships, donation of equipment, etc., to fully combat the innovative methods companies adopt to influence health professionals to boost the sale of breast milk substitutes when not really required. Most of the information on labels of the infant formula by the code is also mandated in the IMS Act and hence a score of 8 out of 10. However, follow-up formulas also need to be brought under the ambit of labeling requirement of the IMS Act. While the IMS Act does not capture nutrition and health claims, these are being regulated by FSSAI under the Food Safety and Standards Act. The Act lays down a comprehensive framework for monitoring and enforcement of the Act, which is why it scores 8 out of 10 in its alignment with the code, but it is faced with some critical challenges. Its monitoring and enforcement, which require dedicated resources, remain unbudgeted even after almost 3 decades of being implemented, resulting in absence of a sustained, functioning implementation and monitoring system, with existing efforts being sporadic and driven by NGOs. It is often seen that while the violations of the IMS Act do get reported frequently by NGOs, CSOs, and others, often these do not translate into imposition of legal actions on breast milk substitute manufacturers. Also, while monitoring of the IMS Act is mandated for health facilities, it rarely gets done, which is one of the contributing factors for our early breastfeeding initiation rates to be abysmal, despite our institutional deliveries being as high as 80% in most states. Most importantly, both the code and the IMS Act do not address the emerging epidemic of digital marketing using social media platforms, mothers groups, blogs, and online streaming platforms, which are being exploited by breast milk substitute manufacturers to promote their products. Hence, it is imperative to bring these under the ambit of the Act. I think one of the participants has also raised this issue in the Q&A session. The Act demonstrates the importance of practical value of legal measures. It reflects a deep commitment to the promotion and protection of breastfeeding and has led to a noticeable reduction in harmful promotion of foods for infants and young children. While being comprehensive and multi-sectoral in nature, it is enforceable through mechanisms that are government-led and empowers to apply a range of legal sanctions in case of violations. With the Act in place, which is one of the strongest in the world, India has managed to increase its exclusive breastfeeding rates from 46% in 1999 to 58% in 2019, with high rates of sustained breastfeeding with a scope to improve further. Also, infant formula sales have been held steady in India, as informed by Dr. Arun and Dr. Dadich earlier, indicating a commitment to keeping the infant formula companies at bay in lieu of promoting breastfeeding and its inherent benefits despite limited funding. Though India has one of the best maternity protection act in place globally, allowing mothers to exclusively breastfeed their child for full 6 months, often we see that this remains largely unenforced, especially in the unorganized sector as well as the organized private sector. The MA program offers ample opportunity to create mother and baby-friendly hospital initiatives, which need to be tapped into, providing necessary rewards and recognition to such facilities. Also, strengthening counseling on appropriate infant feeding from the last trimester of pregnancy, along with peer support after delivery, even in the heavily burdened health system of India, is need of the hour to advance progress in this area. Moving forward, India needs to establish robust and sustainable monitoring and enforcement mechanisms and analyze and address weaknesses or gaps in the Act and act accordingly. The Act must be supported by adequate budgets and human resources to ensure enforcement and monitoring and to apply deterrent sanctions in the case of violations of the IMS Act. Healthcare workers should be educated on their responsibilities under the Act to avoid conflict of interest and fully protect, promote, and support breastfeeding. These are some of the resources available which can be easily adapted and adopted for strengthening enforcement of the IMS Act. With this, I would like to thank you all for the time you've spent for this presentation. Thank you.
Thanks a lot, Dr. Rachita. It's been really wonderful to hear. And let me welcome Ms. Asta Saxena, the Joint Secretary of Women and Child. Welcome, Asta ji, to the webinar. And we have done a couple of presentations. But by now, Dr. Dadich from BPNI has finished speaking, but we will share those presentations with you. And Dr. Rachita has just finished when you had joined. So the point, I think, Dr. Rachita, you have made a wonderful analysis of the areas that need further work and strengthening, and in particular to the implementation and enforcement part, which is quite a challenge as well as need more action by the government, as you rightly say. I think with the point we all need to note what you said about probably IMS Act is the major policy intervention since early 90s, which actually has first cut the decline. You know, in 80s we were having a decline in breastfeeding. So this 70s and 80s breastfeeding was on the decline. It was documented. And then after the law, so we checked the decline for 20 years. I think we remained stable on the exclusive breastfeeding rates. So IMS Act has played a very big role there. And now in conjunction with the Maternity Benefit Act, if it is extended to large number of percentage of women, I'm sure then we can expect very, very high rates of exclusive breastfeeding in next 20 years or so. So that's an important point you made. And certainly, I'm sure your findings are going to be useful for further discussions with the government, and maybe they actually are a wonderful analysis to take forward specific areas where these can be plugged, not only just to score high, but in a way, the point which you made in the end in terms of allocation of funding, for example, for implementation, allocation of funding for breastfeeding or for baby-friendly hospital programs or allocation of, work to given. FSSAI has recently, so people are asking question where to report. FSSAI has recently designated officers of FSSAI, food safety officers, commissioners of food safety in the state are authorized just few days back, which Dr. Dadiz showed. So
I think that's an excellent news.
yeah, so I'll put that link of that order in the chat box so that everybody can see. So the participants who are attending, use that and approach your nearest food safety officer when you find any report of violation of IMS Act, whether it is a promotion of infant formula or infant food or feeding bottle, all are covered under the law. So let's move on to the third presentation by Dr. Gayatri Singh, and you're going to talk on UNICEF's India's perspectives for implementation of the IMS Act. So over to you, Gayatri. You have your 15 minutes here.
Ma'am, you're not audible. Ma'am, your mic is mute.
Sorry. Am I audible now?
Yes, ma'am. Yes.
My apologies. Good morning to everybody, and to Asta ma'am, Dr. Arun, and Dr. JP, and Dr. Rachita. Regarding implementation of the IMS Act, when I was asked to present on this topic, I reflected on whose point of view I should be presenting here. And what I decided is to see it from the point of view of the mother and the family. The reason being is that in this panel, there are experts who are more experienced than I am and have the expertise on the legal aspect. The reason I'm looking at from the point of view of the mothers, because I think it would be the mother and the other family support that she has for breastfeeding that will be critical in determining that breastfeeding is continued and use of breast milk substitute is discouraged. So looking back is, we know, and Rachita has also presented this, is that breastfeeding rates are improving. Globally, there are targets, and breastfeeding is one of the indicators. So it's a sobering thought that while the breastfeeding rates are improving, but globally we are off the target to meet the goal set for breastfeeding. If we look at early initiation, which seems to be a very doable thing, globally it's at 41%, and our target by 2030 is 30%. So surely we are far away from our targets. And this is despite the fact that it is very well known that breastfeeding has lifelong benefits for the child. Beyond survival, beyond immunity. Immunity, I think in this present context of COVID becomes very, very critical. Cognitive development, and also protection from the NCDs. So if you're looking at the whole spectrum of benefits, we need to do much more to accelerate breastfeeding programs to see that the targets are met. How India is doing is, in terms of early initiation, rates are improving, but again, I'm repeating, is about nearly 43% of our children who have to wait very long to be put to breast. And for successful breastfeeding, initiation, establishment, and maintenance of all the aspects of breastfeeding is very important. So let's capitalize and see how do we use this opportunity of institutional births and foresees this missed opportunity. Looking back and reflecting on the programs, there is a wealth of information that we have. We know what is working to improve breastfeeding. What helps the mothers is what helps the mother is consistent and very clear information on breastfeeding. Why is it important? What they need to do? Simple, doable actions. What are the problems? How can they be overcome? So consistent messages have an important role. And with launch of Poshan Abhiyan, Jan Andolan, there is again a lot of focus on breastfeeding and emphasis on how do we deliver standard messages, and everybody talks about the same issues. These educating or reaching mothers once is not enough. We need to reinforce these messages through multiple channels, be it home visit by the frontline functionaries, be it through the media, or or even at counseling at the facility level. We recognize that messaging alone is not sufficient. Mothers will need support, skilled counseling support to help them overcome their difficulties and be able to breastfeed successfully. We have programs like Rachita also mentioned about. We have MA, we have HBNC, we have HBYC, which is focusing on reaching information and counseling to the caregivers. So what is important is to see that our frontline functionaries as well as facility level functionaries are well equipped to provide skilled counseling support to the caregivers. In addition, families need support through legislations. One example is the IMS Act, or also the paid paternity leave, because this will help them to practice breastfeeding, not only at home level, but also when they return back to work. So with this wealth of information, if you look at if you look at code, we know it was in 1981, almost 40 years of the code. In India, 1992. We have come a long way. If we look at it, is the IMS Act or the code still relevant? And if you look back, to this is, what is important is mothers need to be informed. They need to make an informed choice, which is the best option for them to feed their child. So continuing to educate mothers and caregivers is important. We know inappropriate marketing of breast milk substitute is prevalent and probably is taking new forms, especially through the digital markets or maybe indirectly. So the breastfeeding is still under threat. Though India is not showing such steep increases in sales of breast milk substitutes, but nevertheless, breast milk substitutes are increasing. And what is interesting is that it's not only for the younger child that the infant formula is done. Sometimes the target is also for the older child, like follow-up formula, the growing up milk. So we have to look at the entire range, and that's the reason why the IMS Act is covering children up to 2 years. What is important in today's context is, let's not overlook what COVID can do to breastfeeding. Here I would like to mention is the health facility functionaries. They might be diverted to other tasks. So the counseling support that was available to the mothers, it's likely that that is not available because the frontline functionaries have been diverted. Second, caregivers and mothers might have apprehensions about safety of breastfeeding, especially in the context of COVID. So here, and this fear, because I think it's this whole, the fear or the apprehension of the mothers, which are utilized by the industry to promote their product. So earlier family like industry used this, not enough milk, your child is not growing well. So in the context of COVID, they say indirectly implying that it is a safe option. So it's all the more relevant that we keep an eye on the implementation of the IMS Act. This is an important resource. Rachita has gone into the details of how the IMS Act implementation is being tracked globally, and various aspects within the elements of Act have been listed here. India is doing relatively better, but there are areas of concern. Our Act is well aligned to the code, but the areas of enforcement and monitoring mechanisms are weak, which Rachita has highlighted, so I'm not going to repeat. Information and educational, it also covers what information is given to the caregivers, mothers, and general public. It covers information about breastfeeding. It covers information about breast milk substitutes. And then it also looks at advertising and the other aspects and labeling. So there are, this initiative is going on globally to track the implementation of the Act, and it can provide a good impetus to the countries to see where are the areas of concern and what can be done. In terms of how do we translate all these provisions into what's practical, I'm going to focus on the provisions within the Act which prohibits promotion of breast milk substitutes to the healthcare professionals and in the healthcare settings. The reason why I'm focusing on this is because healthcare providers are people that the families trust. They are the credible source of information. So it's important that the healthcare providers keep up this trust and provide the information to the mothers which is accurate, clear, so that they can take informed decision. What I am sharing is based on the work that the states are doing, and we recognize that all the three pieces for breastfeeding, whether it is protection, promotion, and support, they need to move together. So even the implementation of IMS Act needs to be integrated into programs for both support and promotion of breastfeeding. Our experience from the state indicated is that the healthcare providers, considering the crucial role that they can play, but unfortunately they are not very well informed about the Act. Its various provisions, they do not understand it fully. So maybe it has not received the required attentions. It's not only important to understand the provisions in the Act, but also know what they can do as health service providers at all levels to see that mothers are not misinformed and supported to breastfeed. One thing which they can do very, very easily is stop promotion and inappropriate use of breast milk substitutes. That is, see that industries or the market representatives do not offer them free gifts. Do not give them materials which is displayed, which directly or indirectly undermines breastfeeding. That is something which is very doable, is that they stop promotion of breast milk substitutes in the health facilities. Stopping this, telling mothers don't use formula milk, don't use bottle is not sufficient. What is important is you have to have trained human resource with adequate skills to help mothers breastfeed successfully. And at the facility level, especially at the time of delivery, helping the mothers how to on positioning, latching the baby, and other difficulties that they might encounter. So it's important that at the health facility level, we do have trained adequate human resource to provide skilled counseling support. When you're talking to the states and the facility service providers, inadequate number of skilled human resource is cited as one of the barriers for providing support to the mothers who are delivering at the facility level. Support needs to continue beyond the health facility level. And in India, with the network of Ashas and Anganwadi workers, we are fortunate that we do have frontline functionaries who can take on this responsibility. So really extending the support beyond the facility to the communities at the household level. There are provisions under both HPNC and HPYC for home visits, and even under Poshan Abhiyan, that mothers are supported in all settings to successfully breastfeed and not resort to infant formula or bottle feeding. Some of the work that we have been doing at the state level is we do have examples where people have championed, it could be an NGO, it could be a head of a medical colleges. These are good initiatives that do yield quick results, but if we are looking at a sustainable strategy, it is very, very important that this whole initiative needs to be led and owned by the government. And here again, I'm repeating the points that have been made earlier, which would mean promotion, protection, and support for breastfeeding is an integral part of the health plans. There are programs there which are reflected in these plans. There are budgets there to support those interventions. There are budgets to support human resources, and then only it will be possible to implement these programs. In addition to this, guidelines and directives need to be there, like what needs to be done at the health facility level, who has to do what. So experience from the states is where you have clear directives and guidelines of what needs to be done, fixing the responsibility and accountability. It helps in sustaining and implementing the interventions. What work is being happening in number of states is, and this is also a priority under the MA program, is how do we make our facilities mother and baby friendly. I mean, we are not talking more about mother friendly at the moment, but really we need to look at the both mother and child, and how do we make these facilities baby friendly. So initiatives that have been undertaken is at the health facility level, you are providing breastfeeding corners, because this indirectly gives a signal to the mother is breastfeeding is important. I have a space when I come to attend OPD or any other issues to the health facility. There is space available where I can comfortably breastfeed in privacy. So it's really walking the talk. In case there are problems, some of the health facilities are also looking at IYCF counseling centers, having skilled counselors who can provide support to the mothers on counseling. In states like Bihar, and I'm citing example of Bihar because very often we think this is a difficult state. A lot of efforts have been done to make hospitals and develop what is called as a bottle-free zones. So really supporting the breastfeeding for the mothers who come for delivery, who are availing of the services, or whose children are admitted in these facilities. So this is one intervention which has happened and can be scaled up easily. What is also important is if the facilities have to become baby friendly, we need to have a system for facility assessment and understanding and tracking what are the gaps in all the three domains for protection, support, and promotion, and see what actions need to be undertaken. This is a provision under MAP program, and what would needs to work is how this gets integrated and embedded in the existing facility assessment or quality assurance program which are existing. It's about integration and training, and it's once you start looking for it, you understand what the problem is, and once you understand the problems, and then the next step is to find solution and see how these work. So this whole aspect of how to make facilities breastfeeding friendly is very, very important, and it gives a strong message to the caregivers that yes, breastfeeding is important, and at the facility level we are not only paying lip services but really walking the talk. This cannot be done alone. We know government systems are there, they can deliver, but to augment the government capacity, augment the tracking and the monitoring system, or even capacity building systems, effective partnerships need to be set up. Experience has shown that setting up partnership with academic institutions, especially the medical colleges, helps because they can play a role in building the capacity in tracking, and also probably play a critical role in producing next generation of health professionals who are adequately trained in breastfeeding. And simultaneously, what is needed is how all the development partners can come together and support. UNICEF has a partnership with BPNI where we are looking at violation and tracking of IMS Act, among other things, of how do we build capacity of national level to support training. This is the example of bottle-free zone that was coming from Bihar. So it's really it's a commitment from the institution, and normally how it works is it's led by a nodal person who monitors and tracks, and everybody is kind of signing the oath and saying we are committed to make our institution bottle-free. And this was an initial step, but it is growing, and this example can be replicated in many, many other facilities too. Having said this, we cannot only limit it to facility level. I'm not undermining the importance of public education and support. What we are learning is what is being communicated directly or indirectly through the mass media. Till now, written word carries a lot of value. What is reported in the newspaper is seen as gospel truth, and people believe it. So I think what is required is issues related to breastfeeding, issues related to harmful effects of bottle and formula feeding need to be brought out in the public domain, whether in the form of print media, electronic media, and also in the digital media. Information on digital media in terms of breastfeeding, its importance is there, but there is not adequate information in support of IMS Act. So very recently, we are working with BPNI to see how we can have a social media package for different stakeholders to see how we can strengthen the implementation of IMS Act and support the mothers in breastfeeding. I acknowledge that I'm just presenting the work of the state, so acknowledging that this work is from the UNICEF states colleagues, and thank you everyone for patient listening.
Thank you so much to Dr. Gayatri for a very detailed presentation with lessons and future perspectives on how do we deal, in particular institutionalizing the support which mothers need, apart from protecting them from the commercial nature, the commercial onslaught of baby food companies. Of course, such institutional mechanisms and structures which are set up, they go a long way and they're sustainable also, particularly having IYCF, infant young child feeding counseling centers and corners of breastfeeding. So they do bring, a social recognition as well as a technical recognition of the issue if they are hospital based. So that anything that happens in a hospital actually translates into what will go into the community. And then if we continue in the community, the support, the kind of supports you have enlisted, I think that's where all of this combines into the success of breastfeeding made with the first hour, which is fully the responsibility of the health system, no doubt, because most of the deliveries are in the health system. And the moment the mother is actually discharged from the hospital, I'm sure the community level action has to take on, whether it is urban area or rural area, the support system to maintain exclusivity of breastfeeding is very, very important. And that's where the whole effort should be in terms of institutionalizing and sustainable. So thank you very much once again for agreeing to speak as well as elaborating. So we will have some questions in the end where you can come in. Now I move on to our next panelist, is Ms. Asta Saxena Khatwani from Ministry of Women and Child Development. She is the Joint Secretary in the Ministry of Women and Child, and she will talk us to initiatives of the Ministry of Women and Child in implementing the IMS Act. So over to you, Asta ji, and look forward to hearing you.
Hello and namaskar to all the esteemed colleagues here. It's been wonderful listening to you all, and in fact, I am looking forward to your recommendations at the end of it. I did join at the time when Dr. Rachita Gupta was speaking, and then I heard Gayatri ji very succinctly putting it all together. So it's wonderful. In my limited understanding, I think most important thing for implementation of IMS Act is generating demand. That's the most important thing. If the people start rejecting the idea of substitutes, I think that is where our success lies. And I mean, I might sound naive while saying it, but I think in our villages and households of smaller towns, breastfeeding is still prevalent. But yes, I mean, gradually all these advertisements and everything is reaching out there, and the young girls might be feeling that, okay, that is a better way of doing it. But I'm hopeful. I mean, I'm dealing with the Anganwadi services and Poshan Abhiyan right now. Our first and foremost emphasis is on generating demand for breastfeeding. If you have been, in fact, Gayatri ji mentioned about it also. That's our first message. What all is to be done in the 1,000 days, first 1,000 days of life, and how important it is. That's the primary message of Poshan Abhiyan right now. And Anganwadi services are being used for percolating these messages. We start our conversation with them with this mandate. So I'm hopeful that gradually, because of this consistent messaging and this consistent conversation about the relevance of breastfeeding in the first 1,000 days of a human being's life, we are hopeful that we'll be able to generate or sustain that kind of demand for breastfeeding. Demand, I mean, the mother should be convinced, the family should be convinced that this is the best way possible. Because any act, when it is punitive in nature, it would be put to use only after the incidence has occurred, And, so while it is relevant, it is very important to check those who are trying to break the law and, disrupt this healthy practice. But that is one part of the story. Most important is generation of demand. Secondly, in fact, not talking, IMS Act is for you all, and you all are doing wonderful job. BPNI is doing great job in this regard, and they keep us posted about what all is to be done and keep helping us, guiding us in this regard. But apart from that, implementation of IMS Act, for which Ministry of Health has been communicating with the states, and we are also writing time and again, and now FSSI has come up with an advisory or a guideline in that regard. That definitely is important, and that will continue. But another important thing is messaging. I'm just taking it a little forward. What I am reminded of an ad which I saw some time ago in some other presentation, wherein people used to give, the cigarette companies were putting an ad that if at all you are going to have a slim body, you won't feel hungry and therefore you won't eat and you will maintain. And so there were these young glamorous girls shown smoking as a replacement of eating. So that is the power. I mean, smoking was it's highly unethical, and that was being done. Gradually over the years, the word has taken a turn, and now smoking is seen as it is right now. So similarly for these milk substitutes and things like that, because if you would see their ads, you will see all those rich people, very good looking mothers, very good looking children, and they're being fed through, and the milk is very good, the powder milk is good, this, that. So basically these dreams are being sold, and I think it's beyond our ministries only. I think we should other sectors of government also to kind of check these kind of practices, and as stakeholders can also help us how to go about it, because the messaging that is going is linking it to aspirations somewhere. A middle class mother is taught that if at all you use the milk substitute, you will be in good shape, and your child will be very. So that kind of messaging also is to be disrupted somewhere, I feel. IMS Act does its job, but then either we have a very strong counter messaging to put up a standard that, see, breastfeeding is the fashion. That is important, and that is what works. So we are working towards it, and we would welcome more suggestions in this regard from all of you about what to be done. The job of the ministry is keep hearing you subject experts and getting the wisdom from you and then taking it forward. So please feel free to write to us directly or through BPNI. In fact, I'll request BPNI to please collate all these pearls of wisdom and share with us. And we hope to work on that in collaboration with you all. So I would not take much time. Today we are wrapping up the Poshan Maha, but we are taking all the agendas forward. So I will rest my voice here, and I really look forward to further interaction with you all or listening from you all in this regard. Thank you so much.
Thanks a lot, Asta ji, for your discussion and what ministry is doing. Particularly, we are aware of the Poshan Abhiyan taking on a big shape. And thank you for your offer to continue this dialogue with us, and also in terms of working together towards getting all this, whatever we are already doing, we will try and do more also in terms of collating information. So if you are staying for a few more minutes, then we can finish the questions, answers. Or you are in a hurry to leave. That's why I'm asking, otherwise I can do it right
Actually,
now.
I'm working on a wrap-up session right
Okay.
now, which minister is attending. So my
So
colleague is here from FNB,
okay.
Ms. Anita Makijani. She will participate if you would permit, and I'll seek your permission to exit right
So
now.
just for a minute, if you can stay.
Sure.
The couple of things which comes to my mind after hearing about from you is to link up more, strengthen our links with BPNI in a more formal fashion. So can we propose a meeting with you either through Zoom or in whatever way we can, maybe next week or whenever you have time, right?
We'll do that, sir. We'll organize more.
Okay. So, secondly, I would give a piece of advice to continue to organize and coordinate on breastfeeding issues, because the Ministry of Women and Child has a body called National Breastfeeding Committee and a National Coordination Committee. Breastfeeding Committee is headed by the Secretary, and the Coordination Committee is headed by you at this point. So if we can have regular meetings of that helps in bringing in stakeholders, bring in states, and also, you know, keep a check on what is happening, what is not happening, so that we can, so there we do find in last 5 assessments on breastfeeding policy and programs, this area is weak on policy side, though there are several strong areas, but funding into breastfeeding interventions at the state level, we have several examples to share with you. So we do find this constraint. So
I appreciate I fully appreciate your advice and concern. But yet I would say that to my mind it appears better to integrate it with the bigger picture. So
sure.
While it may not appear that separately there's something happening, but I am privy to every discussion, and everywhere it starts with breastfeeding in our discourse. Any kind of meeting we have, anything we have, when we talk of nutrition, we talk of breastfeeding. So we are integrating it in everything. And I think that is important. If I just separately talk about it, which may be good to talk to you, to experts like you and others, and get your wisdom on board. But I think it's important for the layman to get the whole package at one go. Sure. And see, okay, fine, 1, 2, 3, 4 is to be done, you know. So I have to worry about anemia. I have to think that breastfeeding is done, and all of it put together. This is how I can improve the well-being. So we are working on that, and I look forward to having the meeting. Wonderful. Anita is here with me in this group only. And Anita, I will request you to please organize this meeting at the earliest. So thank you so much for
coming.
This opportunity.
Yeah.
Thanks a lot. Bye-bye.
Yeah. Wonderful. So friends, now we will we look at the questions, and we will take on the questions now. Several people have asked questions. Many of them have been responded to in the chat box itself. But if there are any still, if there is anything still very important you want to ask, so I'm going to ask one by one. So the first point which I also like to emphasize is was the first question by Geeta Shri on how to protect, and of course we can give an answer that, you know, you report the violations and all, but only yesterday we found this NDTV in, you know, NDTV on their website advertising foods for Nestle, Zarrin, and there is another new companies. So they're advertising infant foods through their articles. So this is a big thing, you know, big players are there. Amazon is selling them through these advertisements. So the point is that how do you protect this whole onslaught of which we are facing, because the action on the courts is slow, the investigation and prosecution, as far as the government is concerned. How do we take it forward? If we can, who will take this question? Would you like to respond to it? How do we take it forward in terms of preventing more violations by big players?
I don't think I'm really the competent one, because I think you have the expertise. But one thing that I would like to mention is we do not have a system. Now it's really individual, or maybe a few people who are tracking what is happening. So very often this comes to your notice, people's notice, and then they pass on. So the promotion avenues are increasing. So can we look at how these can be systematically tracked and then probably brought to the notice? Because I think at present, I don't think there, correct me if I'm wrong, I don't think there is a system for tracking this, whether it is in the electronic media or maybe also in the other digital space, or even when you're looking at online shopping and all. So can we look at a system maybe, and once that is tracked, and then it is brought to the notice of the competent authority? Because what we are seeing is a number of times it's when BPNI has written to the authorities that the action has taken place. But yes, it is important to set up a mechanism for tracking this.
So I think that's a wonderful suggestion in terms of, putting a formal tracking system, right? Yeah. So when we meet our joint secretary next time, and probably, we could move in direction. There's another question which was asked to the ministry, but has been answered, but Hemant Das has asked it again, that this is for the joint secretary, but now she has already left. But the government advisory, he's seeking a government advisory, which I would like to say, Hemant, that one of the government advisory has already been issued, and the link has been shared in the chat box. So you can pick up that link of FSSAI order, which is one of the best things happened so far in the monitoring of this law, that it has designated all the designated officers and the food safety officers, which I believe they are available in every district in my mind. And the Commissioner of Food Safety is also authorized. And your another question of declaring a district hospital as bottle free, the examples as given by Guy, I think we have to approach state health department. Yes, JP, can you answer?
I think in this regard we can also look into examples of certain states. In fact, Government of India wrote to all the chief secretaries few months back to nominate and designate district level officers to monitor the IMS Act, and few states have already done it, and some of them are in the process of doing it. We are also following it up with a few states like Bihar and Jharkhand has already, issued an order. So this mechanism is also being established now for district level monitoring and then reporting.
Okay.
Yeah.
All right, and let me just check more questions and come back. How to increase awareness among food safety officers is another question you have answered, but it may be useful to answer it so that other people can also hear in different states. So can you think of, Gayatri, how in the states, the food safety officers can be oriented, trained, so that they can start monitoring it? Gayatri? Sounds like...
Sorry, I was having a difficulty in unmuting myself.
All right.
This is a very important aspect, and I think it is important that we do have a sensitization package for the food safety officers on the various provisions and what are their roles and responsibilities. So I think that would be the first step. So one would be, of course, seeing opportunities for face-to-face orientation, but also seeing if a digital package, looking at the restrictions because of COVID, can be designed so that they have the complete information. Because our experience has been that the medical officers who have been trained on breastfeeding are also not fully aware, and this is a new set of people who probably have not had the similar exposure. So designing a sensitization training package and then seeing how it can be delivered would be very, very critical. Also looking at maybe once how it can be integrated into the existing mechanism for capacity building. That would be all.
Okay. Yes, JP.
Yeah, just adding to what Dr. Gayatri was saying just now, in the ongoing collaboration between BPNI and UNICEF, we have developed an annotated PPT on IMS Act. It's already ready, and we can use this PPT for doing awareness generation among the newly empowered food safety officers. But if they want to get empowered for monitoring the act, then probably they will require a longer duration of training for 2-3 days. I think some of them, if we can do it state by state, BPNI has this capacity to do it, provided that the state governments they come together, and if UNICEF can facilitate that. Yes.
Okay. Okay. There's another question on whether there has been any engagement with the FOXI gynecologist and obstetricians by Ivani Sethi, and including FIGO. If WHO is aware of, Rachita, any international liaison with the Federation of International Gynecologists? And in India, we are aware that have been in touch with there was a network which operated for many years. FOXI was a party to it, called National Partners on Breastfeeding. So FOXI had been participating of late only in last, I've seen only in last 1 or 2 years, we have seen baby food companies infiltrating into FOXI. And this year during Corona, they picked up more energy to get into FOXI in terms of implementing on the webinars. So we have been in touch with the FOXI once again, but I love the idea which Gayatri gave on a more systematic approach to this subject. So Rachita, any thoughts you can share?
So Dr. Arun, since this question is specifically on IMS Act, I think you are the better person to respond. As part of, however, the global initiative, FOXI is involved as an expert in different networks and in development of the different guidelines, and both the obs and gynae people, they are also an integral part of the early initiation of breastfeeding. So yes, at global level, they are involved.
Wonderful. The next question is about the stakeholders, which are, I hate this word, but I'm using it because the question is, implementation of IMS Act is healthcare providers, IMA, IFB, FOXI, office bearers are not aware. So even if they no, they never implement the act. So this is Professor S.V. from Tamil Nadu. Uh, I think he has a point in saying that they are not aware. And secondly, some people, they are even aware, but they are more in the views which are picked up by what Nestle or any other big company, Danone, or guide them that this is not a violation. So you go ahead, which happened in terms of research funding, which we found last year, which happened during webinars, which happened during a lot of seminars which the companies have been connecting by, say, for example, Nestle Nutrition Institute, or, you know, and these four companies, big companies, have also joined hands in to make a NGO called Infant and Young Child Nutrition Council of India, which influenced FSSAI to issue an exemption to them. So all this is I think it's part of a bigger scandal which is motivated by the industry, and this nexus sometimes plays very wrong in the interest of children or others. So I can only say, Professor SV, to continue the efforts the way we are already doing in every state. It requires more and more awareness programs, more in a systematic manner. And when we meet the Government of India, Department of WCD now, we will raise this point, how to systematically organize the awareness programs. We will be happy to organize for every state, but resources don't permit us to do so at the moment. Another question is from Ruma. Is more like a suggestion. There should be sessions on adolescent girls, would-be mothers during pregnancy, on nutrition, care, breastfeeding benefits, which includes this. Yes, we agree with you. I think no denying the fact that if we, for example, specifically on breastfeeding, and protection of breastfeeding, it must begin during pregnancy and continue. Yeah. So we have done. Just a second. Yovani has another question. Do we have a coalition of lawyers to promote and track IMS? I can't say, Vani, it's a coalition, but we have few lawyers who are concerned about it, right from 1980s actually. There's a lawyer who is now in Supreme Court, the senior lawyer Chandaruday Singh, and there is another lawyer, Mr. Ajay Kumar, who had been assisting us in the case against Nestle, and not many others, but we tried to reach out through Law Commission once, and did some orientation there, but not many lawyers are actually informed about this. Yeah. Okay. Right. Okay. The privacy of the person putting the complaint provided. Yes, I think Dr. Surabhi has asked this question. So, what is the privacy of a person who complains? So, BPNI, when it receives complaints, keeps the person who informs, unless that person is willing to give his or her name. So we keep the privacy, and we inform the government. That's the role assigned to BPNI, to make a complaint. So BPNI is authorized by the government of India to make a complaint. So we do make a complaint, and if resources permit, we also complain to the court of law. Yeah. Thank you. Okay, let me see just one more. There is question. ICDS THR norms are 500 for both breastfed and non-breastfed children. This value is more than what should be available from complementary foods. Your views. So this is not the topic of the discussion today, Sharika, but if anyone wants to answer this question on, otherwise we can discuss it, privately. Yeah. How to improve early initiation of breastfeeding in the private health facilities. Any thoughts on this? Rachita, can you take this?
Dr. Arun, can you repeat the question, please?
How to improve early breastfeeding, initiation of breastfeeding in private facilities, which is quite low in Bihar and
Yes,
in
I think
every,
I
yeah,
responded to this
yeah,
question online
yeah.
itself. So I think what is required is more strict implementation of the IMS Act and regular monitoring. And also, I think somebody had asked us in the uh, perspective of private hospitals. So I think for public, we need to integrate relevant monitoring indicators in the NQAS and for private in the NABH so that we don't have a parallel system just for monitoring early initiation of breastfeeding. It's integrated into the routine monitoring system itself, and we ensure that it's done. Also, I think Gayatri had responded to this question saying that we need to improve the counseling of healthcare providers, the counseling provided by healthcare providers so that early initiation is done and breastfeeding is well established. Over.
Thank you. And so this is done. There is another question on how to strengthen BFHI activities by Suparna Roy, with other programs. And do you want to take it again? Because we are already thinking of here more program. And Gayatri or Rachita, can you think of further how to strengthen BFHI activities further?
So, Dr. Arun, what I would like to clarify participants is that under the new BFHI guidance, the accreditation part has been removed because it's not sustainable. Uh, and that's one of the key changes that has been made. In terms of strengthening the BFHI activities, I had mentioned in my presentation as well, the MA program offers ample opportunity to do that, to designate hospitals as mother friendly and child friendly. Um, so if there is some method of say reward or recognition, I'm not talking about monetary incentive, but for hospitals to uh, you know improve their practices, I think that would be key. So we do need some reward or recognition, which is also the one of the fifth pillars of the MA program. So it's not operationalized yet, but yes, like I said, by integrating it into the current assessment mechanisms, we can do that effectively with minimal resources.
Okay. Okay. There was another question to BPNI whether World Vision can work with BPNI. I think we can, if you can write to BPNI, we can discuss it, how it is possible or not possible. After we can have a chat. Then there is, I think a lot of questions are coming on breastfeeding versus bottle feeding. Some facilities during COVID times allow mothers to touch the newborn babies. So I think for COVID related queries, please go to WHO site or BPNI site has a COVID corner where the guidances are clear. Those who are doing, they need education and orientation that they don't separate babies. So that would be my advice to you. There is another question on there is OTC sale of formula.
Dr. Arun, I would like to add over there.
Please do.
So in terms of guidance on breastfeeding and COVID, with support from WHO and UNICEF, Ministry of Health has come up with very clear guidance in terms of a decision tree available in local language as well, which guides the healthcare providers to take informed decision on whether or not they should go on to formula feeding for the infant. It's a stepwise method that has been provided as to what are the alternatives we should go ahead and select before we finally make the choice of formula feeding. Simultaneously, there is another guidance which is directed to the mothers and the family members on promoting breastfeeding among COVID positive mothers as well, again by the Ministry of Health itself. These are all available on the ministry's website as well.
Wonderful. So thanks, Rachita, for adding on this value. Do you think cesarean delivery directly or indirectly promotes bottle feeding? Yes, I think there is a perception, question by Hina Gosar. There is a perception among the health workers also that mothers who deliver by cesarean, they cannot begin breastfeeding. So, but here comes the role what already panelists have already emphasized, the role of support, where lactation counselors or ICF counselors can be by the side of the mother, can support, and bottle feeding can be avoided. Do you have any rule against over-the-counter sale of formula milk or online portals? I think, JP, do you want to take this question? Do you have any rule against sales of formula online sale or
Yeah.
OTP sale?
I don't think that there is a rule against selling these products on these platforms. But of course, promotion of any kind or incorrect information being given on these portals, or any kind of incentives like discounts or giving any gift or tied sales, etc., they are all prohibited under the IMS Act. I can also share some experience with the two large these online portals, Amazon and Flipkart. We found some products were being sold on discount, and then when we reported it to authorities, and then authorities wrote to them, and now if you go to these websites on some of these products, a disclaimer is always given there that no discount is no discount can be given for these products. So they have started doing it. So I mean, sales is not prohibited, but of course any promotional activity is prohibited under the IMS Act.
Okay. Then there is, let me just read another question. Recently, I happened to go through Tamil Nadu State Board textbooks. Nowhere in the nutrition section exclusive breastfeeding is included. I think IMS Act and exclusive breastfeeding should be included in the education. I am sure we all agree to this, that it must start as early as possible. So, okay, some people have asked question to join BPNI. I think you can write to BPNI at bpni.org. Visit our website and you will know how to do it. So that these are easy. Some people have asked for the PowerPoint presentations, if all the panelists are okay to share. So we will put them onto the website and all the participants can take a look at that. So this thing, I think I have taken almost all questions, but still, if we are not able to answer right now, I promise that we will examine this question box again and respond to when there is chance. So that brings me to.
Can I add, Dr. Arun, one thing here?
Yes.
Yeah. I think those who are willing to get more information about the IMS Act, they can go to BPNI's website, and there is a tab on specifically for IMS Act, and a lot of information related to IMS Act over the years of what all activities have happened and what orders have been there from the government and what action was taken by the government or BPNI, or awareness generation documents developed by BPNI and other agencies. They are all compiled at one place. So they can go there and utilize those resources for their own understanding and their own work. Yes.
And those who want to receive regular information from BPNI, you can just share your, mail to write to us, that you want to be on a regular information, so we can share with you whatever developments in this field are taking place. So now to end the session, I'll very quickly brief everyone to that this is a very, very important law which it took us 11 years from 1981 when it was first passed by the WHA by a resolution to getting into a law in 1992. Then another 11 years when we got an amendment to it, and the law got further strengthened. It became a law which was now covering all the foods for children under the age 2. So that means anything for feeding babies under the age 2, if you are selling it commercially, you cannot promote or advertise. The definitions of advertisement and promotion are very broad. If you read the section 2 of the law, they are very, very broad. The law is available on BPNI website. It is available on the website of Ministry of WCD, and we can share with you any specific information if you want. In 2005, this law also came under attack from the industry by way of a proposal for repealing this law was made. So it took us many months, literally on the streets, another struggle to get the law back on the track and save it from being repealed. So that's why I'm emphasizing to every participant today that we need to continue to work hard if we want to protect mothers and children through the protection, promotion, and support of breastfeeding, and in particular, protecting them from the commercial influence. It is very, very critical, whatever work we do in the field of promotion, by way of commercial promotion, that is washed off in no time. In particular, families who listen to the doctors or other health workers, if they communicate a message, it's, that give formulas should not be a problem. It certainly, so these are the things which are important, that under the companies continue to win over the health workers through their relationships, which they make through sponsorships or other things that creates either silence or they play low. So, and that's where the formula gets promoted. With that, with a very important information which we have shared with you of food safety officers, which are available in every part of India. They may or may not even bother to look at the notification issued by the Central Food Safety Authority. But we as participants can take that note from the link which we shared in the chat box, or go to the BPNI website, it's there. You should remind your food safety officer that this is important. You take up your role as a food safety officer and employee for monitoring the IMS Act and initiate. What is important is this: we need to request them to initiate inquiry into it. It's a cognizable offense. They have to have an inquiry and launch prosecution in case they find. That will really be a turning point in strictest implementation of the law, even about 30 years after its passage. We will continue to get civil surgeons on board if we can. We are writing to the ministers of health in every state so that they are able to nominate the civil surgeons also to increase the effect of this implementation in the country through the health authorities. Civil surgeon being a district health authority can be very, very effective. So that brings me to the end, and thank you everyone, particularly our panelists today and all the participants who have patiently listened to, and several of you participated by asking questions, which were very good. We enjoyed talking to you, and we still will remain open. Whenever you have any question, you please continue sending us, particularly how do we get the law, effectively implemented. Thank you so much for your kind attention to all what we are doing. Thanks a lot.
Some
Yeah.
questions are still unanswered, so we will look into them and we will send them by, answer by emails in coming days.
Okay. If they are, then we should. Yeah.
Yes.
Yeah. So we promise that we will send you this response soon. Yeah. Anything else? Any last comments by Gayatri or Rachita, or should we close it? Yeah.
No comments from me. Thank you very much. This was a good webinar and very informative.
Thank you, everybody.
Thanks.
Thanks, everyone.
Thank you. Thank you. All right. Bye.
Bye-bye.
Bye-bye.
Thank you, Zarrin.
Thank you. Yeah.
Thank you so much, sir.
Thank you, Dr. Arun, for nicely coordinating and chairing it.
Thank you. Thank you. It's my pleasure. My pleasure.